As mentioned in the previous video, the changes to hormones in the body with the onset of menopause can lead to many physical symptoms and physiological changes. Today we'll be looking at the physiological alterations that come about with the onset of menopause. Some of these changes that we will be exploring today include changes to body composition, insulin resistance, muscle mass, bone density, cardiovascular health, and cholesterol. Several studies have shown that perimenopause, independent of age, is associated with an increased fat in the abdomen as well as a decrease in lean body mass. So what this suggests is that menopause plays a role in that transition from more of a pear-shaped body, so where the hips are wide and the thighs, and where more weight is below the waist, to more of an apple-shaped body, where you have wide waist and a belly and more weight above the waist. Other studies have shown that lower estrogen not only increases appetite and food intake, it's also associated with changes in fat, mass, and fat distribution. A lack of estrogen has also had negative effects on your metabolism, which may reduce the rate in which your body actually burns calories and how effective it burns it, including starches and utilizing blood sugar. And the end result is actually an increase in fat storage. So you may have heard of the hormone insulin. Now, insulin is a hormone that is produced in the pancreas, and its role is to help regulate blood sugar levels. So what then is insulin resistance? Well, insulin resistance means that the body's cells don't respond normally to insulin, meaning we cannot get sugar out of the blood as easily, and therefore it's harder to regulate blood sugar levels. The hormone estrogen actually helps to control insulin resistance. It is known as an insulin sensitizer. As we know with menopause, estrogen levels decrease, so lower estrogen has actually been linked to insulin resistance, which is why postmenopausal women may gain weight, particularly in their midsection, and therefore have an increased risk of developing type 2 diabetes. As one begins to age, there is age-related loss in muscle mass, which can result in a decrease in muscle power too. This can be referred to as sarcopenia. As we discussed previously, there is a decrease in estrogen with menopause, in particular changes to estradiol. Our skeletal muscles actually possess specific estradiol receptors at the fiber level. So estradiol can actually promote muscle regeneration, which can contribute to muscle health. So a decrease in estrogen acts directly and indirectly on muscles, and it contributes to sarcopenia. We also see that with a decrease in muscle mass, there is an increase in intramuscular fat. Preventing sarcopenia and preserving muscle strength are highly relevant in order to prevent functional impairment. Peak bone mass in females occurs approximately at the age of 30, and from here it begins to slowly decline, and with menopause begins to decline at a faster rate. Estrogen plays an important role in maintaining bone strength. After menopause, estrogen levels drop, and this may result in an increase in bone loss. The average woman loses up to 10% of her bone mass in the first 5 years after menopause. This can lead to the progression of osteoporosis. There is also a decrease in calcium absorption from food, which can impact bone density. Changes to bone can lead to an increase in fragility and fracture risk. Exercise and nutrition are used as a countermeasure to these changes. It has been observed that estrogen helps to protect women against heart disease. During menopause, as estrogen levels drop, the level of fat in a woman's blood can actually increase, and these changes put women at risk for developing heart and circulatory system disorders such as high blood pressure, high cholesterol, and heart disease. Menopause does not cause cardiovascular disease. However, certain risk factors do increase around the time of menopause, and a high-fat diet, smoking, or other unhealthy habits that do begin early in life can also take a toll. So menopause can actually result in lipid profile changes. with 10 to 15% higher lower density lipoproteins, or LDL, known as bad cholesterol, and an increase in triglycerides, so the circulating fats. And we also see a decrease in HDLs, or high density lipoproteins, the good cholesterols. Now, an increase in LDL can actually result in a build-up of plaques in your artery walls, which we know can lead to other health risk factors. So now we've explored all the changes that occur in the body with menopause and changes to hormone levels, and how this can sometimes lead to many physiological alterations. Whilst you may be at an increased risk of some of these physiological alterations after menopause, not everyone will experience them. Luckily, the risk of these physiological alterations can be prevented or even improved with lifestyle changes, including incorporating exercise into your routine. So join me for our final video of this series as we discuss exercise and menopause.